Every now and then, I have the opportunity to present, air a show that's of phenomenal importance. So I am so happy to have, as my interviewee today, Dr. Jeffrey Stevens. And first of all, Doc, how you doing?
I'm well, sir. I appreciate the opportunity to speak to you today.
Yes, sir. I appreciate you doing that. Tell us a little bit, first of all, about yourself.
Well, I grew up in Georgia. I was born in Tennessee. Did all my college and med school here, and residency at Emory, and I did infectious disease at Wake Forest University. And I came back to Macon and joined the faculty at Mercer and at the medical center almost 30 years ago now. So I'm officially an old person. Been here almost 3 decades, and so I've done infectious disease. I do research, teach residents and students, and provide clinical infectious disease services to the community and to the region.
Outstanding. So it's my understanding that infectious disease is a specific department, infectious disease department. So talk a little bit about the role of that department.
Well, we're kind of flavor of the month these days. Most of the time, we're not flavor of the month. We're like the licorice ice cream that nobody really likes that much except certain people. But just like you can become a specialist in heart disease after your training, or lung disease, or kidney disease. I did a fellowship extra training after my residency in infectious diseases. We actually have an infectious disease fellowship at the medical center, and we teach in that, and we train people to do what we do. We only have one fellow a year, but infectious disease, there's 300 or 400 spots in the country each year, and we actually are one of the only three training programs in Georgia that have a fellowship. And so people who are trained in infectious disease help others take care of infections in the hospital and as an outpatient, take care of HIV, wound infections, infections in the blood, that sort of thing, complicated or more, or when we see people have very resistant germs or TB, all those kind of things would be kinds of infections and things that we would do. We also help people when they travel around the world to try to prevent infections, malaria, treat those when people come back. We do all those kinds of things, and so we're the lowest paid though. Source of medicine. We're lower paid than regular folks who train in what we do. We do extra training, and if I didn't do any more training after my internal medicine residency, they make more than us. So it's kind of a
Wow.
funny business. We do more training and get paid less. So how about that? So, but we are the
Yeah,
flavor of the month these days. So
yeah. Well, I tell you one thing, it's gonna go up with
uh,
COVID-19 and the
well,
importance of treating infectious diseases. I guarantee you that you're gonna get a raise real
well,
soon.
from your lips to God's ears, as they say. So
Yes,
let's see.
sir.
Hopefully, we'll see what that happens.
Yes, sir. You mentioned a whole lot of different kinds of infectious diseases, and I want to address, if you would, and talk about the similarity and the difference and how you uh, contract them. Let's talk a little bit about the flu and COVID and whatever background you can give us on both of them as it relates to their similarity and their differences, and how to treat and prevent both of them. If you would just kind of address that at your leisure and as much as you want to talk about each one of them, as well as the combination of the two.
Well, most of my life, probably most of my research has been in HIV. But if you ask me, since day one as an infectious disease doctor, the most fascinating illness to me has always been influenza. Because it's very interesting. We have that seasonally. In the northern hemisphere, it's usually November to March. In the southern hemisphere, it's during their winter, which is of course during our summer. It's but it also seen throughout the year. But flu is around each year. There are a couple of different types of it. It's a virus that's spread person to person, usually via respiratory mainly, which is much like COVID also. You can also get it off surfaces and things like that, but most of it is transmitted from person to person. And about 10, 15, 20% of people get flu in a given year. They may not get very sick with it because you've had flus in the past and you may have some partial immunity. But probably the most important thing about flu is that, about 20, 30, 40,000 people die in this country every year of influenza. And of course, we do have the flu vaccine, which is not perfect. And we have to make the flu vaccine based on last year's strains. There's actually a committee that meets in March in the Northern Hemisphere, and it meets in the fall in the Southern Hemisphere, and they pick the strains that they think are going to be around. It's sort of a guessing game. It's like trying to figure out who's going to win the Super Bowl next year. You kind of know the favorites, and they kind of pick the favorites. But of course, the flu evolves. Evolution keeps going on, and every year the flu changes a little bit. We call that drift. It kind of the genetics of it, of course, and those viruses get passed around in birds and pigs and us, and they kind of get all rearranged sometimes. And when that happens, you have a big jump in the virus, and that's when you have the big flu outbreaks, the pandemics. Like we're in a pandemic now with COVID. We have pandemics with flu going back 400 or 500 years. There's been about 16 or 17 pandemics. The last one we had was in 2009. Not a terrible one. It started in the United States, Southwest U.S. and Mexico, just like the big flu in 1918 also started in the United States, even though they call it the Spanish flu. They only call it the Spanish flu because Spain was neutral in World War I. They had to put it on somebody. And of course, the U.S., we don't want to do any of that. So that's why naming things and we don't like calling the names of where stuff comes from, like, the China flu. You don't want to do that because, especially when it's in your backyard, you know what I'm saying? So we don't like to do that anymore. I actually got into a big fight with a doctor about that, and I said a bad thing about him because I told him he was acting poorly about that. But again, flu changes every year, and that's why we have to do a flu shot every year. One of these days, we may have a universal flu shot that will last for a long time and get multiple. That's sort of one of these holy grail things, and we're probably closer to that than people think. The flu shot technology, though, goes back to the 1940s. So flu, you can get pretty sick. And the thing that people don't understand, when you get sick with anything, your body gets inflamed. Well, guess what? You have more strokes, more heart attacks after that next few months. So a lot of the people don't die of flu itself. They die of secondary complications. They get a secondary pneumonia a couple of weeks later. They have other troubles, complications, because it knocks you down, knocks down your resistance. So influenza is a bad actor. And I will tell you, I still have a lot of people, and Georgia is 49th or 50th in vaccination rates. And there's so many people who they don't want to get a flu shot, and they say it makes them sick. It can't. Yeah, you might get achy and have a little arm pain because you had an injection, but you can't get flu from a flu shot because it's killed. It's dead. It's just the proteins. It's not possible. Now, we actually do have a living flu, weakened one, nasal spray. They don't use that much anymore. It's kind of gone out of fashion, but we did have that for a while, a weakened version, so people didn't like shots. They don't use that much these days. But and we do have some medicines that if you take them pretty soon after you start getting symptoms within a day or so, but a lot of people wait 2 or 3 days before they call anybody, and it really doesn't work very well at that point. So we have a vaccine to prevent flu, and we have some medicines to help it, including a couple of new ones. But still, just like with any kind of illness, if you get a bad pneumonia and your lungs fail and your body gets very sick, which happens to certain people, or if you're older, have bad lungs, bad heart, bad kidneys, people can do poorly. And as I said, about as many people die in a year or two from flu or flu complications as died in Vietnam and that sort of thing. And people don't think about that. And I get so tired of trying to get folks to get their flu shot. And it's not perfect. Some years it's not a good match because the virus has changed. As I said, people are trying to guess what happened from last year, and it sometimes is good and sometimes is bad. In 2009, much like in China where they had this virus sequence pretty quick, the CDC had the new strain in 2009, the epidemic strain. They had it fixed pretty quick, knew what it was. They started making the vaccine for that. It took about 6 months. So actually we had all summer in the fall when flu got going again a lot, we had a vaccine. So we had to have an extra flu shot that year. People didn't want that either, of course. But now that strain is still in the shots we have now, that particular influenza A. But we don't have that for COVID, and COVID's a little different. It causes a respiratory illness too, mainly passed person to person through respiratory thing. Yeah, you can also pass it from surfaces, but that's a lot harder. It's possible. You have to kind of be in the right place, at the right time. And I see these people wearing gloves. It doesn't go across your skin. They'll touch something. They'll touch their face. That doesn't help at all, to be honest with you. Gloves are kind of silly, but if you wash your hands. But I've seen people with motorcycle gloves on in the Kroger. I just think it's pretty funny. It's pretty funny business. But COVID, is a new virus, and evolution. These things get passed around. It's not man-made. The genetic sequence is pretty clear that this is a new virus. Probably came from bats, which are one of the reservoirs. Got into humans somehow in late fall last year, and it's gotten going, and now it's a true pandemic. And, again, there have been tens of millions of cases worldwide. We've had 7 million plus in the United States. We've had 330,000, almost 340,000 in Georgia. If Georgia were a country, we'd be in the top 20 worldwide of countries if we were a country. We've had 6,000 cases in Bibb County.
Wow. Okay.
I had COVID. I had COVID. I had COVID too.
Did you really?
I was sick for 3 whole days.
Wow.
I was very lucky man. I was a very lucky man.
I'm glad you're doing well. I got a couple of things. Right. I got a couple. First of all, I got my flu shot last Friday. So, I believe in the flu shot, and I'm glad. And we'll talk about COVID after I finish what I'm saying. But I'm glad you're encouraging people to get a flu shot. I don't know what's going on with all these myths and misconceptions and self-appointed infectious diseases experts. So I'm glad to hear somebody who though on the page has the right kind of training to really pass valuable information as it relates to this. Now, talk very quickly before we get into COVID about, is there anything you can do to prevent the flu?
Well, yeah, you can, besides getting a flu shot, well, yes, you can, in the winter, avoid, being around other folks as much as you can. You can wash your hands. And if you didn't get a flu shot and you're around somebody found to have flu, guess what? You can take the medicine we use to treat flu, one pill instead of, when we treat with the Tamiflu type drugs, it's one pill twice a day for 5 days. But if you can actually prevent it or help prevent it by taking one pill a day for 10 days. So if say there's an outbreak in a nursing home and a couple of people just got there and had not had their flu shot and there's flu around, you can give those people the medicine we use to treat flu as a preventative for 10 days. And it actually does work. So you can actually prevent spread of flu with some of the flu drugs too in an outbreak. But the point I was also making is that one of the problems, Mr. Habersham, is that you're infectious with a lot of different processes for sometimes a day or two before you have any symptoms. That's the thing about healthcare workers. You may wake up and you have a little scratchy throat and you say, gosh, that's kind of interesting, but you may not be very sick, but you may have a low grade or what we call subclinical infection with things like flu, and you can pass it to other people. And that's why we're so aggressive about flu shots. And I've had physician colleagues of mine say they've never had flu, and I just shake my head. I just, because they've had it, they just not been very sick from it.
Right. Right.
But but in a given community, about 10, 15, 20% of people will get flu unless they're vaccinated in a given year. Over a period of 4 or 5 years, 10 years for sure, everyone has had flu. I mean, I've had a flu shot every year since I was in medical school 35 years ago. And I don't remember any illness that really was absolutely classic for flu, but I probably have had some mild cases of flu along the way. I've not been very sick, but during those times when I wasn't very sick, my patients could get it from me.
Okay.
Or my family. That's why I think it's so if people don't care about themselves, they should also care about their family, and if they're a healthcare worker, others. And that's why we pretty much make it mandatory for people at the hospital to get their doctors and nurses. We make it mandatory. And the recommendation in the United States, if you're above age 6 months of age, you should get a flu shot. If you're breathing and you're 6 months of age or older, you need a flu shot.
That's a good opportunity to segue, if you please, in the COVID-19. You just mentioned. Go ahead, Doc.
Well, COVID, it's a new thing. It's a respiratory illness, but people can have other signs and symptoms. You can have a headache and cough, shortness of breath, and get pneumonia from it. You can have diarrhea from it. People lose their taste and smell. There's a bunch of things, but it's pretty much what you see with viruses in general. The only thing that really, it's hard to tell the difference of flu clinically. About the only thing is flu's a lot of times more abrupt. Classically, is comes on zoom, boom like that very quickly. But again, that's not perfect. Not everybody has that. But this loss of taste and smell, which I've not noticed a lot, seems to be pretty specific. I've had some people complain of that in the past with other things, but this loss of taste and smell, that's very suspicious for COVID. That's one of those things. If you ask me the one thing that I would say would make me really think COVID would be people who come in complaining that. And I actually have a colleague of mine who had an exposure. He's had a couple of negative COVID tests, but he's lost his sense of taste and smell. I still think he has COVID, and we're kind of playing with that right now. But there's a lot of overlap in symptoms. The respiratory ones, cough, fever, muscle aches, all that can be seen with both. But COVID, for a lot of people, probably 20 or 40% of people have no symptoms at all, or minimal symptoms. And that's what you would expect, though. And people are just surprised by that. But look at flu. A lot of people have subclinical flu every year, too, or minimally symptomatic. I mean, everyone in their life, as I said, has gotten up in the morning and, boy, my throat's a little scratchy, and you may feel a little achy. And then a day later, you're fine. You say, gosh, is it something I ate, or I didn't get enough sleep, or whatever? You're probably fighting something off that you have some partial immunity to. And that's good that you do that most of the time. But as we get older and as we have more medical problems, you have more risk of more troubles. And the same way with COVID. The older patients, heavier, folks of color, comorbid conditions, diabetes, especially hypertension, weight, age. The older you are, your risk factors go up for having to. Not a guarantee. I always tell people I treat people, not numbers. Numbers help me take care of people. But obviously, and I've seen lots of folks in their 80s with COVID do well. But if you get up in your 8th, 9th decade and you're in the ICU and you have COVID, I mean, that's a pretty decent mortality. And I've seen some young people do poorly also, but I've seen young people do poorly with flu over the years. Every year or a couple of years in the ICU, we'll have a time there'll be a bunch of beds full of folks with flu. And people forget, people always ask me every year, how bad is the flu going to be? I would say if I knew the future, I'd pick lottery numbers or pick the winner of the Stupid Bowl. I mean, you don't know what it's going to be until time passes, though. I will tell you, if people are doing the things to try to prevent COVID this year, you would hope that there would be fewer flu cases. And they noticed that in China when they were on lockdown. They had much fewer, because they're spread in very similar ways. So if you're not spreading COVID, you're not spreading flu. And that's why we're really hoping that people will take to heart, the social distancing, the mask wearing, the hand hygiene, and get their flu shot, because boy, oh boy, a bad flu season plus COVID this fall. I mean, I think November, December, we're going to be really busy anyway. I mean, we're going to have a lot of COVID. It's my expectation. Maybe I'll be wrong. I hope I'm wrong, but my expectation is we're going to be very, 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 very busy. Certainly in Europe, they're having the second wave now. It's been Europe is in bad shape right now, and so I suspect we're right behind.
Well, why do you think, Doc? I mean, what's with people not taking it seriously? Young people are still partying, and I mean, because it's getting worse and it bothers.
Well, I think part of it is fatigue of, they want to get back to some sort of normalcy. They want to go to football games. They want to be with their family and friends. But, there is probably people were hoping in the summer when it was hot that you wouldn't see this. And it's probably not as much to do with the heat, maybe the humidity, but people are more indoors in the fall and winter. They're closer together in general. And there's just more respiratory illness, and we can argue about why that is, but certainly flu has a seasonality, even though you see a little bit even in the summer, you see it more, as I said, November to March kind of time frame. I suspect that no matter what we do, we would see more cases overall coming up, but if people are not doing those things, we're going to see, I'm afraid, a lot more. We're still seeing, we went into Labor Day with about 40,000 cases a day in the United States. We went into Memorial Day with about 20,000 cases a day. So, the numbers have been down in Georgia. We've been really, the July, August, we were just almost overwhelmed with, and we came way back down. I think we're beginning to slowly pick back up. And I suspect that November and December will be busier unless people keep, really try hard to keep that from happening.
So, I guess it's pretty important that we emphasize that personal behavior can play a role in whether or not, you get infected with the flu and or COVID. And I just, it kind of bothers me, because, you don't know who has it or,
Well, and that's the problem is that there will be people that you're around that have no symptoms that have COVID or have flu, and that's just the fact of life, and that's why. And a lot of people, would when they're quarantining, they quarantine with their family, but then their family sees somebody else, and then they all become part of the same quarantine group. A colleague of mine yesterday. Child is coming home from one of the biggest, 2 or 3 biggest colleges in the state with COVID this week, and is going to go home to isolate at home. And I said, that sounds about right. And I think the colleges have done pretty well with testing, and we've been able to keep going. But it's just, it's not going to be zero. And until we have a vaccine, I suspect that we'll need to do masking and do a lot of these things for another 15, 18, 24 months. And people just don't want to hear that. They want the narrative to be a different way. And I wish that it would be that way. But I just can't imagine that we're not talking about this, dealing with this, certainly 6 months from now, 12 months from now, maybe by the year after, if we get a vaccine, if people take it, if it's effective, if we do, if. I think that we'll see some improvement, but I suspect that, the next couple months, the next 6 months are going to be pretty much more of the same.
So you don't see any signs of any significant changes and or improvement in the very near future?
Well, again, I think you brought up the point. I think it depends on human behavior. It depends if we do have a vaccine early that is effective and safe, and people on the front line and people at the highest risk can get it. But we're still having 40 or 50,000 cases a day, been sometimes as low as 20 or 30. But we're not having like 0 cases, or 100 cases. We're in Georgia. We're kind of in a better place now than we were a month or so ago, but we're still having 1,000 or so cases a day.
Are we getting better? What's the situation? 2 questions for you as we wrap it up. What's the situation in the immediate area? And finally, just take a couple of minutes to just talk to the community about what we need to do, kind of wrap that up as it relates to dealing with flu and COVID-19.
Well, the numbers have improved in this area significantly. Some of the surrounding counties are a little worse, but overall we're better than we were a few weeks ago. And Georgia has been better than it was a few weeks ago. My concern is that people will take that as, everything's all okay. And remember, in Georgia, we're still having about 1,000 cases a day or more. And we were up to 3,000 and 4,000 there for a while. And a little bit higher than that. But again, we're around 340,000 cases in Georgia in 6 months. and we've had about 7,000 deaths. Worldwide in the United States, we've had almost 220,000 deaths. In 1957, in the flu pandemic that year, very similar to this, we had 110,000 deaths, but we had half the population. So when we get to 220 in a few days, we'll have about per capita on average the same number of deaths as we had in 57. And I remember talking to one of the old Mercer administrators many, many years ago in the 1990s. He was talking about in 57 in the student health center, seeing all the students lying on the floor in pallets with flu, just lined up. Of course, we didn't have anything for it back then, and so, but now, of course, we have better supportive care. We do have some medications, that sort of thing. But people, we're going to have to try to be better about doing the things that we know we're supposed to do. But I think people are tired. They're tired of this. They want to get back to normalcy. And, I like to be young, good looking. I was young once. I never was good looking. I can want it all you want, but, it takes a while to, you can want all that you want, but all joking aside, mask is not the answer to every question, but does it work? Yeah, 60 or 70% less chance of transmission. And if everybody wore a mask 100% for 2 or 4 weeks, you'd see a tremendous drop. But again, there are times when you take it. There's always going to be exceptions to every rule, and there are a lot of people who just don't want to do that. They feel that somehow, like people don't want to wear their seatbelt. When you're wearing your seatbelt, you're not hoping for an accident. You're saying if you have an accident, you want to try to keep yourself from, the same way with a mask. You're not saying, gosh, I'm not going to do anything, and this is the answer to everything. But it certainly does make a difference, and masking is important. And since I'm sitting in this room, nobody else around, I took my mask off so we could talk, because a lot of times you can't hear me. But, I'm pretty much 100%. And, and I understand that people feel strongly about that in the other way. And, you can't argue when folks feel strongly about something like that. It becomes something that it's like, people arguing over their favorite football team or, favorite kind of barbecue sauce. It's not a battle you can really win.
Yeah.
And you don't try to win that. But in the old days, you could agree to disagree, and maybe you can make some points. These days, there's a lot less of agreeing to disagree. It's either my way or the highway. And that worries me, because, we're going to have other pandemics. And actually, there's a bad flu in China floating around right now. And we've been worried about its pandemic potential. The World Health Organization, we're either pre-pandemic or pandemic. You're never post-pandemic. We're always waiting on the next one. This will happen again. Maybe not in my lifetime, maybe not in your lifetime, but it could happen tomorrow. It could happen next year. We could have something new.
Well, first of all, thank you so much, and I appreciate your knowledge, your fervor, and your dedication to making a difference as it relates to infectious disease and imparting very, very significant information. And as it relates to COVID, then it's tremendously important that we follow the guidelines for being safe from COVID to the extent possible. Wear a mask, wash your hands, and social distance. This is a call to action, and I'm your host, Alex Habersham, having interviewed Dr. Jeffrey Stephens, infectious disease expert who has brought us phenomenal and useful information. Doc, thank you so much. Thanks for all you do. We really appreciate it. And I hope that everybody behooves what the doctor is suggesting as it relates to dealing with the flu and COVID-19. This is a call to action. I'm your host, Alex Habersham. Have a great day.